Hi, I'm Dr. Barbara Paris. I'm the Vice Chair of Medicine and the Director of the Division of Geriatrics at Maimonides Medical Center in Brooklyn, New York. I went to medical school at SUNY Downstate in Brooklyn, New York, State University of New York, and after that I worked for a few years in Boston as an emergency room physician, and then I decided that I'd like to be a geriatrician after having seen so many older patients who I felt weren't getting appropriate care in the system. And I came back and I was the first fellow who trained at Mount Sinai School of Medicine in geriatrics. I did that fellowship over a 3-year period, and then I took on a job at Mount Sinai and the full-time faculty. When I first came to Maimonides, I was 16 years old, and I came here as a candy striper from high school. And I still remember my first patient, who was an elderly man who I used to come feed all the time. Somehow, even as a child, I was always attracted to older people. And when I had my own children, my daughter noticed that every time I would go into a room, she'd say, "Mom, you're always going over to the oldest person in the room." And I would say they are always the most interesting people that I meet are the older patients. My specific interest in the area of geriatrics is the frail elderly patients in the community setting, and how to keep them in the community, and how to avoid the hospital setting and nursing homes. Most dangerous points for older patients are when they transition from one setting to the next, either from the doctor's office to the hospital, or from the hospital back to home, or to a rehab setting, and the information and the medications often get very confused. So one of our strengths is that we coordinate all of that, and we are the same group of people, or even the same person in many situations, who will take care of that patient in each setting, and that will eliminate or certainly minimize those kinds of very serious complications. We make a large effort to prepare families and patients, and it's sad when it's a sudden death, but often there's an opportunity for closure, for hospice care, or for a family gathering at the end of life in someone's home. And we will be there in their home with them. We don't abandon patients because they can no longer come to the office. When I started out in geriatrics in the 1980s, the average age of patients in my office was probably 75 to 80. The average age of patients who I see now in the office is 85 to 90, or 80 to 90. So there's been a shift. Patients live longer. Many of them, hopefully, under our care, functionally intact, or we help them stay functionally intact in the community. So it's actually very, very gratifying. And when patients die, they really are mostly at the end of their life. I came to Maimonides over 10 years ago, having realized that Brooklyn really needed a center of excellence in geriatrics. And Maimonides in particular, when I came here, I immediately saw that within the neighborhood there were so many advantages. Within the radius of this medical center, there's a nursing home, there's an inpatient hospice, there's ambulatory care, and there's a whole community of patients that couldn't get out of their homes. So I saw this as an opportunity to coordinate their care in all settings, from being healthy people who are able to come to my office, to being sick in the hospital, to needing rehab or nursing care, or to needing end-of-life care at home.